Hi, everybody. My name is Farah, and today I'm meeting with Dr. Spodak, who is coming to us from Florida. He owns a dentistry clinic, so he's going to be walking us through his daily life at the dentistry clinic, as well as some challenges and his role in leadership.
Hey, Farah, good to be here. Thank you for making the time to have me on. I'm excited to talk to your audience and hopefully provide some value.
Thank you. So, can you share a bit with me about your role and how it fits into the bigger picture at your company?
Yes, so I'm a third generation dentist. I guess it's a genetic abnormality that's been inherited through different generations. My grandfather was a dentist, and my father started a practice here in Delray Beach, Florida, which is on the southeast coast. And I graduated from Tufts University Dental School in 1998 when you were like negative 10 years old. Um, and wound up working here in the practice and was a dentist here, clinically practicing for almost 25 years. And recently, in the last 3 or 4 years, my roles changed a little bit, but I dreamt to revolutionize the way people experience dentistry. With a lot of your colleagues, they're looking forward to their appointments with you. And I can speak very candidly that many of our patients are not looking forward to their dental visits. In fact, they're dreading their dental visits. So I dreamt to create an environment and a space that would revolutionize the way patients feel and perceive the dentist and experience the dentist.
How did you do that?
So this goes back a little while ago. So I was a dentist working with my dad, in a kind of just a nondescript building just down the street. And I was a really good dentist. I paid a lot of attention to my craft. I went through a lot of continuing education to become what I would consider like an exceptional dentist. So I was getting really good results, specifically cosmetic results with my patients. But I realized that, patients don't generally understand the level of quality they're getting. So whether it comes to, a hospital setting or any type of medical office, it's hard for patients to really judge the quality of what they're getting. Obviously, the aesthetics speak for themselves, but for the general dental patient, they don't know the difference between good and great. So I started reading a bunch of books. I remember reading a book called If Cleveland Clinic. Oh, no, I'm sorry. If Disney Ran Your Hospital. It's a great book if you want to, give a link to that. But it measured the reasons why patients refer to other patients or refer people to other patients to facilities. And one of the big through lines is that patients judge the way they're treated and the way the facility looks as one of the leading indicators of why they refer their friends and family. You would think, as a medical professional yourself, it would be on the the type of outcome you're getting. But in actuality, it's how the team gets along and how the place looks. So I just said, you know what? I'm going to build this crazy facility, 13,000 square feet. I'm going to make it look like the Apple Store of dentistry, and I'm going to try to fill it with the best professionals I could possibly find. I found a bank to loan me the money. I built the building, and there was a missing link I never realized I had to leverage. It was leadership. So you can put all the right people on the bus and, have all the right things going on. But if you don't have good leadership and systems, the business can ultimately fail. So I had a 10-year long struggling journey to kind of fumble my way towards a successful outcome.
Wow, I actually saw the building when I Googled you. I
Oh,
was like,
yeah.
oh, is he in architecture too? Jack of all
Yeah.
trades? It
Well,
looks
I was lucky. I met a very famous artist who since passed away. His name was Michael Singer. He did like the U.S. Embassy in Greece, and he did a terminal at the Denver airport, and he did a whole bunch of really iconic things. And I was following him and like watching him, and I met with somebody who coincidentally knew him. And I said, hey, Michael, would you build my building? Not knowing that, he could do it in a way that could be affordable for me. And he did. So, we have a piece of his art history. He built he designed the building, and it's in his books, and he has permanent installations at the MoMA and the Guggenheim. So, yeah, a very famous artist had something to do with dentistry.
That is so cool and so unique too. You rarely ever see that.
It's becoming a little bit common now, Farah. People are like really investing in their facilities. I know this guy out in Springfield, Missouri. He built this ridiculously amazing facility. It's like makes mine look like it's like a toy. So it's pretty cool. Like, there are people that are paying attention. And when we look at a lot of healthcare settings, when you go to the Cleveland Clinic or you go to some of the more iconic healthcare settings, they're pretty impressive architecturally. They want to inspire you.
That's amazing. And can you walk me, like, what does a typical day look like for you? You wake up in the morning, what happens?
So my typical day now is a little different. So, now that I've retired from clinical practice, my dream, as we were talking about just before we hit record, was to build an autonomous, self-managed team. So I wanted to have an operation that could run without me. And it was hard because I was the main person, the business is named after me, and I was the main provider in the business. So it took a long time to kind of decelerate my clinical practice and accelerate the other practitioners that were here in the environment we have. But now at this point, my team kind of jokes with me that I have like seagull management, where I come and squawk a lot, poop, and then leave. So I'm best served in limited doses at the office. So I'm here probably a couple days a week. Fun fact, I have a cattle ranch in Okeechobee, Florida. For those that are watching, it's called Savin Ranch. So I raise Akayushi cattle. And 3-4 days a week, I'm actually there playing cattleman, kind of playing
Wow.
cowboy. So it depends on the day. If I wake up there, it's very different from when I wake up here in Delray, Florida. So if I wake up over there, it usually starts on a side-by-side, a 50-pound bag of feed, me feeding cows, letting out the chickens, trying to drive my tractor, my mini excavator around and have fun there.
The
But
American
I don't,
dream.
yeah, I guess so. I guess so. Yeah, I guess so. But it's fun. I'm having fun out there.
Yeah, it sounds like fun.
Yeah. Yeah. So, when you become an expert in one area, it's very fun to dabble in a new area where you're a novice. So with the Cowboys that I have 2 full-time people that work the ranch, and it's amazing to them how little I know. They're like, you don't know how to do this, or you don't understand that. I'm like, no, because I'm a 54-year-old dentist from the coast, and this is all new to me. I'm learning a lot, but I am pretty helpless out there, and I enjoy being a novice there because I get to be an expert in my real life.
Yeah, exactly. And you've been in dentistry for so long, so I'm sure you have some amazing insight. What major shifts are you seeing in the industry right now?
Oh, wow. So many shifts. It's a great question. Dentistry is not what it used to be. So from advances in same day technology, 3D printed materials, AI everywhere, from how our phone systems and intake is being handled to missed calls, to the design of teeth. It's crazy. The software revolution, hardware revolution in dentistry is astounding. I mean, when you think about how dentistry used to be done, and for many that are listening to this, maybe their dentist is still practicing this way. But for those that are on the cutting edge, there's no more goopy impressions. It's like 3D scanners, 3D printers, so that crowns and veneers can be made in as little as 1 hour. So no more
Wow.
temporaries. Anesthesia and the level of pain control, sedation and different types of sedatives that we have, and all the way from, conscious sedation and nitrous oxide laughing gas all the way up to being put to sleep and waking up and your whole mouth is redone. It's pretty crazy. It's a good
Yeah.
time to have a dental problem versus like having a dental problem 20 years ago.
Yeah, I've seen that shift too, especially with the anesthesia. I've just noticed a lot of dentists are now having anesthesiologists partner up with them so that their patients can be more comfortable during procedures. I think pain is like the main thing that patients usually worry about, speaking for myself, when they go see a
Me
dentist.
too. Me too. Like, listen, I'm a dentist and I don't want to go through this stuff. It's pretty gnarly. Unfortunately, it's, we have great pain control and stuff like that, but it's very personal. It's up in your face. It's scary. The noises vibrate your head. So, listen, I'm going to be the first to admit, in our office, when I get a dental cleaning, my teeth are sensitive. I actually have nitrous oxide, like laughing gas, because you turn it on and you're in la la land. During my cleaning, I'm very comfortable. I turn it off in 5 or 10 minutes. I'm back to normal. I can go about my day. So there's no hangovers or anything like that. So I'm going to be the first to admit, I'm a big believer in being comfortable.
Yeah,
I don't need to get a medal for what I endure at my dental office.
it makes a huge difference in the patient experience. Yeah,
Big
for
time,
sure.
big time. Yeah, big time. I know. You know what they say in medicine? They say what the difference is between a major and a minor surgical procedure is. Major when it's happening to you, and minor when it's happening to them. So
Ah,
every doctor's like, oh, no big deal.
Yeah.
we do this all the time. I mean, geez, it's pretty gnarly. It's a lot of these elective healthcare procedures are not comfortable. I wish more of our fellow colleagues would actually use more sedation.
Yes, me too. I'm going to go
Yeah.
to Florida to your clinic from now on.
Yeah. Well, it's a little far for you, but I'll welcome you to come here. But I think your dentist should be able to provide at least nitrous oxide,
Yeah, I've never
which is laughing
asked,
gas.
so I think I might now. I won't seem like a
Yeah.
baby now that I know that you do it too.
Oh no. The funny thing is, so all of our providers here, all the hygienists, all the doctors, we have 12 different doctors and 9 hygienists and 67 support team. Almost all of us get some level of sedation for all of our procedures.
Wow.
Yeah,
I
and
like
we're
that.
the ones that do it all the time. So it's like, duh, what do we know that y'all don't?
Exactly. And then you also mentioned how AI has also, you've also seen a shift with AI impacting the industry. How has it impacted your business and your growth strategy?
We're using it for just about everything. So like our calls have AI interfaces on them. In the state of Florida, you have to write an encounter report essentially in your electronic medical record from a phone call. So imagine you're an administrative team member, you're on the phone, it's busy. You have to take all these notes, and then when you hang up, the phone rings again. And by the time you get to the computer, it might have been 3 hours ago. Like, what did he say? Did he say he's been in pain for 2 days, 7 days? Did he take the antibiotic? Did he not start the antibiotic? So now our calls are AI monitored and they get transcribed as one small thing. So when you hang up the phone, there would be a transcription of the call and it would automatically be entered into the EMR, the electronic medical record, or and all the keys, by the way. So if you see emergency and pain or tooth extraction, it might prompt that we need an oral surgeon. So that's just a small thing, but even in our 3D printer software, teeth are designed with AI. So like teeth are being designed in software with an artificial intelligence that is just amazing and is getting better all the time. Like even our experiences, a year ago, I wasn't using ChatGPT. Now it's like my best friend. My kids tease me and ChatGPT knows everything about me. So when I upload my blood work and I'm like, someone recommends a supplement and I put the supplement, like this supplement would be great for you because of the fact that your blood has this or that. So, large language models are not going anywhere and they're going to be indispensable tools. The only difference is how comfortable people like me and you are talking to them. And if I'm a case study, I'd rather talk to an LLM than anyone else. I don't mind talking to a bot. I just don't want to talk to a poorly engineered bot. That's what we've been talking to for 10
Yes,
years.
exactly. Yeah, and now they sound so realistic. Like when you call, do you have the one that the AI receptionist as well?
Yeah, we do, but it's only for overflow, and it wasn't that great, so we turned it off. But we're waiting on one. But I'll tell you what, the other day I made a scan. I don't want to drop any names, but I made there's a very popular MRI company that's making waves for a preventative health scan. And I called and I literally had to say like, hey, I know this is a random question, but you're really good over the phone. Are you a real person? Are you AI? And it was like, no, she's like, no, I'm actually real, but it was so perfect. And for those of you who run any type of healthcare clinic and you have, at least 50, 100 Google reviews, you could actually tell even at a large language model like ChatGPT, hey, pretend you're a receptionist at Spodak Dental Group and I'm a patient in pain. Let's role play. And you will be blown away without any engineering how darn good that could be. So if it's good without any prompt engineering, imagine what the future is like, Farah. It's going to be crazy.
I know. I told you my background is I have my own AI agency and we implement like AI receptionists for healthcare clinics, and it sounds just like a real receptionist. Like patients be like, you know what, never mind, I'm gonna actually call somewhere else, and they're like, wait, like you mentioned this and this and this, and it's
Yeah,
crazy. It's like a real
I know.
person, like thinking logically. I'm like, wow,
I
this
know.
scary where the future is going, but it's also amazing because of how much it's able to help us, like, help patients and improve our practice and everything.
I mean, I'm just like, listen, it's scary just the same way that cruise control was scary. But if it lightens your workload and allows you to help more people, I mean, then I'm a big fan of it. We are demoing different products and beta testing things because I'm a key opinion leader for one company, and it's very promising. It's very promising. It's not an if, it's a when we all are using it. It's absolutely not an if, it's a
Yeah,
when.
that's what I always say too, because everyone's heading towards that direction.
Yep.
What's
I wouldn't be
working well?
surprised. Sorry, I was just about to say I wouldn't be surprised if you're an LLM, but maybe
Oh,
not.
what? An LLM?
A, a large language model and
Oh,
AI.
I'm sorry.
So funny enough, my partner on our podcast, you might see behind me, I run a podcast called the Bulletproof Dental Practice Podcast. We got 3 million unique downloads on it. So it's getting some level of success after these 8 years we've been at it. But my partner uploaded LLM and AI with all the things we've ever said, and it can speak in my voice. So
Wow.
my kids have actually played with it. I have a 13-year-old son, and it's like, what would my dad say if blah, blah, blah? And it is so eerie. Your dad always says this, because I have, 500 hours of content online. So it is eerie and it told him exactly what I'd say, which
That's
is wild.
amazing.
Yeah, it's like downloading your brain.
Yeah, even when you're with your cattle, you're also at home with your kids.
Yeah. Oh, yeah, it's true. Yeah.
Yeah.
Yeah. I think an AI version of me might be better, actually.
Yeah, for sure. And then what's working well for you right now and what's also been frustrating?
Um, for me, I'm in a constant growth mode. I just want to get better over time. I want to, iterate and become a better father, better husband. I want to be better as a leader. I'd say one of my major struggles was early on in my career. I wanted to try to control everything, and I thought I could. And, I always say that if you want to go into leadership, the first person you have to lead is yourself. So what I've noticed is as I can grow personally, the organization tends to flourish alongside me. And when I've been at my least good versions of me, everything kind of crumbles. So I'm a big believer in all development starts with personal development. So, I'm just trying to figure things out, what's working well and when it's not working well, what's the commonality. It seems like in my life, things work better when I'm in doses. So I joke with people, I'm like, aspirin, a baby aspirin could be good for you, but 50 aspirins can kill you. So I'm trying to figure out the right dosage for me to be everywhere in my life. Right dosage for me is good.
Yeah, especially when you have so much going on, it's hard to split yourself into so many pieces and be great at every aspect. So I
Yeah,
think a lot of people, may struggle with that or are trying to navigate that.
sure. Sure. Well, let me ask the same thing. What is working well for you and what's a struggle in your world?
Honestly, it's the same. I have a 2-year-old son, and then I'm also in school for nurse practitioner, and I also work 50 to 60 hours a week. So finding
That's
the
busy.
time to, yeah, I'm very busy. So finding the time to nurture myself, but also nurture all these other aspects of my life has been very challenging. So I just take it day by day. I do little things that make me happy every day, even if it's an hour going to the gym, going to the sauna, some yoga, some boxing, doing like the little things, going for a walk. Those are the things that really like feed my soul and make me feel better and give me that motivation to move on to the next task.
Yeah, that's a lot. You've got a lot on your plate, and especially being a mother of a small child, it's. I think women have it especially difficult. There's a like this, and I'm probably speaking out of turn here because I can't opine on it, but it's like when guys are producing and out in the workforce and crushing and pushing, we get a lot of like praise from other guys. There's like this sex bias, and then when women do it, it's like very difficult. You all have to walk like this very fine edge of like mother, provider. It's like if you have too much on one side, you can get a lot of criticism.
Oh
You
yeah,
have to
for
be this
sure.
perfect balance of everything, the right
Yeah.
amount of work, the right amount guys don't have to deal with that a lot. If they obsess over work, they don't get like negative feedback from other men about like that. But I noticed it happens. Like my wife was like that too. And when we had our firstborn, she was gunning like what you are 60, 70, 80 hours a week. And it was really especially difficult for her
Yeah, it's
more than me.
hard. It's hard because you're expected to provide now in this age as a woman, like in their new era, it's like, you're not a stay-at-home wife anymore. At least most people aren't. So you're expected to go out there and provide, but then yet you have to also, cater to the home life and your child and your husband and or partner, and it's hard to navigate it all and do it all and be exceptionally well in every aspect of it. So I think
It's
time to
almost impossible, by the way.
yeah, it really is. It really is. And
Yeah.
it's so nice to hear a man, notice this for once. I feel like it's mostly women noticing it amongst themselves, but it's so nice, for a man to like notice and appreciate that. So thank you.
Yeah, well, one of the things I do is I have a mastermind as part of my company. So we have 47 people in our mastermind, and there's an equal split of guys and gal business, men and women business owners. And it's just I get to experience after doing, taking 200 people through the course, the unique challenges that are there. And it's like when we get down to it, it's like, in life, you get one ticket and you have to figure out what you want. And then when you get it, you have to like what you got. Because the greatest failure of all is thinking you want something, getting it, and being unfulfilled. It's a terrible thing for people. And when I really just, when you ask a business owner, what do you want? It's always money. I want to make this. But when you really distill it down, it's actually not money that many people want. They want freedom. And of course, money gives you some modicum of freedom. Like you can't be free if you can't buy food. But after that, it's just interesting. And then when I talk to a lot of the female business owners that I get to consult with, it's like a lot of them are like, hey, I just want to get out at 3. I just want to seem like, I don't see that as much from the men. Like I want to get out at 3. But a lot of them, I just see that. And I just feel terrible that people are, going down paths that are in conflict with what they really want. Because, I had a 10-year period where I never got out at 3. And there's a famous quote that I love. It says that the price of anything is the amount of life you're willing to trade for it. And I traded a lot of life over 10 years. I don't regret it. And I also happen to have like a role or a family situation that allowed, my wife to kind of throttle back. Because when I met her, she was making a lot more money than me. And we were kind of like, who's going to be the provider here? Is it going to be you or me? And we really didn't know. And she said, okay, I'm going to pull back, but you better pull ahead. So, but it was 10 years of like not being there. I don't regret it, but it was a lot of choices I made, sacrifices I made for those choices.
Yeah, that's a huge sacrifice, but it looks like you've gotten to a place where you're successful now and you're able to take a step back and spend more time with your family and enjoy your hobbies and doing all that. So it might have been worth
Yeah.
it, it looks like over here.
Yeah, no, it was, but it's, I could have gotten there faster, but I knew what I wanted. I was very blessed to meet somebody and, a person in my life. She was my office manager. Her name was Michelle. And she was very insistent on like me creating like this ultimate like vision of what I wanted to create. So she really pressed on me to articulate what I wanted. And then, so that kind of helped me get there. Cause I think a lot of people are chasing a goal that they really haven't thought about. They've actually probably hijacked someone else's goal. Like look at Dr. Jones or look at what they created. Or look at that med spa. I'm going to go do that. And they hijack the other person's vision. They wind up getting everything they ever wanted. I'm like, this sucks. I hate it. That's a terrible thing.
Yeah, definitely. She sounds like a gem, by the way, leading you in the right direction.
Yeah. Michelle, she was,
Yeah.
yeah. She's no longer with my company, but she was great. Everybody shows up, for the right reasons. If you just take the learning, it's cool.
Definitely. And where do you want to be like 6 or 12 months from now?
That's a great question. So I'm in an interesting stage in my life. I am happy with status quo. If I could live last year over again, obviously I want new experiences, but like the way things are going generally, knock on wood, I'd love it. But I've got a team that now is hungry. So my team, I feel like kind of being, I used to feel like I was pushing people towards new goals. Now I'm being pulled towards them. So my team is all like, what's next? What's next? What are we going to do? My consulting company, my team there is like, let's grow, let's grow. So I'm in a stage now where it's like, okay, I feel a sense of responsibility to grow for the sake of others, which is cool. Because it used to be feeling very alone, trying to get people to follow. And now they're like, hey, come on, Craig, get on the bus. So we're going to grow. We're going to expand the business. We're breaking ground in 60 days. We're remodeling our entire practice. We're adding 5 more treatment rooms. We'll go from 13,000 square feet to like 16,000.
Wow.
The consulting company's growing. We had our largest summit ever. We had 500 attendees, standing room only, at the Ritz-Carlton in Orlando. We have an upcoming summit at the Phoenician in Scottsdale, Arizona, August 5th and 6th. We're planning to do 750 attendees. Podcast is growing, trying to raise cows and maybe go into the meat business. So going to be selling like, organic, pasture raised, farm to table beef. That'll be cool.
Yeah.
That's
Something
what that's.
different.
I'm sorry.
Something different.
Yeah. I mean, look, our laws don't allow us to know where the meat we're eating is coming from. We have very opaque laws from our government that, you could send a bunch of beef from all these weird countries and package it differently and then say it's actually U.S. beef. So that's kind of freaky. Like, no one wants,
Yeah.
I want to know where I'm eating my stuff from. So this will be a bespoke like beef product that you actually know is real, and you could come and see the animals if that interests you. Because there's a move for people to see their food and know their food. And a little,
Yeah.
I don't know if you want to know your food, but you
Find
definitely
out.
want to know where it's coming from. I know the food. That's a little bit freaky.
Yeah, for sure. And last question, if you could solve one major challenge in your practice today, what would it be?
Good question. One major challenge in my practice. So I have a unique environment, and so my challenges are a bit unique. Dentistry is getting better, thank God, with advent of software and people like you that are being industrious to solve the problems for our clinics. I think for my specific challenge, we have doctor turnover. Things happen, of course. People leave organizations, but doctor churn, like having a doctor for 5 or 7 years and that person deciding they want to move to Hawaii, or they don't want to be a dentist anymore, or they love this or that. That's like the one major challenge. So in our organization, we offer like a pathway to partnership. So if you're an associate doctor, you can actually buy into the organization, which is financially really great for them. But I'd say if I could wave one magic wand, I'd find great people and retain them. That would be my biggest challenge.
Yeah.
And we do, by the way. I don't want to paint a bad picture. I have doctors that have been with me for 16, 15, 12 every years. But, it takes a long time to teach the system and get them, entrenched. And life happens. You know how it is. People move on. Things change.
Yeah, I think that's a common challenge in a lot of businesses. People move on. They,
Yeah.
change hard, build families, want to move. So I think that's a common challenge.
Yeah. But you asked me for the magic wand. That would be it. I'd wave it.
Yeah. That's
What about you? If you had one thing to change in your world, what would it be?
I'd be a stay-at-home Pilates wife.
Good. All right. Get your do you have a partner or a husband? We'll get him on here and tell him how he's going to
I know. I told her, I was like,
earning.
baby, you need like 3 or 4 jobs so I can stay at home.
Oh, what a beautiful
But
thing, though. What a beautiful thing. And you said it
no,
so
I would just
quickly,
want more time. Sorry, what
I'm
was
sorry?
that? Oh, I just
No, I
said I would
love
just
the
want
fact
more
that you
time.
just came. Yeah, but I love that. You said it. It's kind of cool. Why not?
Yeah, I feel like once you have kids, you just want to spend more time with them and stuff like that. I feel like I don't want to miss out on milestones. So if I had a magic wand, I would just be, doing cool stuff with my son all day.
That's awesome. Well, listen, there's a way to do it. You can just keep pressed on the gas and doing what you're doing, and you'll get there as well.
Yeah, definitely. Thank you so much for meeting with me today. I really enjoyed talking
Of
to you
course.
and learning from you. And I'm sure a lot of our watchers are also going to learn from you. So I really appreciate you meeting with us.
Thank you so much. I appreciate you letting me go all over the place from cattle to teeth and back to AI again. So thank you
Yeah,
for
I loved
allowing
it.
the full gamut of my crazy brain.
All right.
But
Thank
if
you
you want
guys
to get,
for watching.
of course, thank you so much.